Hi there. So today I'll be demoing Curovana. Curovana is basically the flight simulator for medicine. It's a place where doctors can safely learn. Medical students and doctors can practice their clinical reasoning on virtual patients, the comfort of their homes. So let's start with the case. So this is a patient called Meera Nair. She's a school administrator and she's had a fever for about 5 days. So here we can choose the language in which we want to talk to the patient in. I'll choose English for now. And we can also choose the patient difficulty if we want it to be a realistic patient. So we model the behavior as well. So the patient can refuse things, they can refuse the treatments, and they can be misinformed about certain things, they can be fearful, they can be mistrusting. So we model the behavior of patients based on real people that you will have to encounter in clinical practice. So you can chat to the patient or you can use the voice mode. And you can set your learning goals as well. At the end, you'll get a debrief and feedback, and you can have that be based on like your USMLE preparation or NEET PG preparation. Let's just stay on clinical training for now.
Meet Mira Nair, 52, on the hospital ward with 5 days of fever, a chesty cough, and worsening shortness of breath. Her oxygen is low and she's hoping to avoid admission if possible. Dr. Mihir, it's your turn.
So this patient seems hypoxic. So let's dive into the case.
Doctor, I am having trouble catching my breath.
Okay, and how long have you been feeling this way?
Well, I've had this fever and a chesty cough for about 5 days now, but the shortness of breath really just got bad today when I was walking in from the clinic.
So have you measured this fever? Like, did you use a thermometer?
Yes, I did. It was around 38.8 degrees earlier today. I've been feeling so hot and then shivering with chills.
Have you been coughing up blood? Can you show me? Can you show me your cough, like how exactly the cough is?
No, I haven't seen any blood, but it is very chesty and yellow, almost a rusty color. I can't really force a cough on command, but it just comes on when I try to take a deep breath.
Okay, I'll get you started on some oxygen.
Oh, thank you, doctor. I think that would really help me feel a bit more comfortable.
As you can see, her O2 sats have already improved a bit.
Ah, that feels a bit better already. Thank you, doctor. What were you saying?
I'll get you started on some fever medication as well.
Oh, thank you so much. I would really appreciate that. My head and body have been aching so much from this fever.
Not to worry, we'll take good care of you.
Thank you, doctor. I really appreciate you taking the time to help me feel more comfortable.
I think we should also do a respiratory examination. So I'll be hearing your lungs for any abnormal sounds. Just take a deep breath. I see that, yeah, I see that we heard some crackles while auscultating your lungs. I think you might need to be admitted to the hospital.
Oh, dear doctor. I was really.
Uh, so I think we also need to order some tests real quick.
Okay, doctor. What kind
Yeah, we'll just do a CBC and a sputum culture.
of...
So we can also order via voice. So this is just asking me to confirm these orders. I'll just say cancel because I just want to talk to the patient.
Yes, doctor. I'm listening.
And like these results won't be available immediately. We need to forward the time a bit.
Oh, I understand. I'll just wait here then while you get everything sorted out.
So let's skip time. So we can see her chest X-ray findings. We can even generate an X-ray image. We can here see her CBC findings. The culture will take a bit of time. I can't forward that much because the patient might deteriorate by then. First, I'll have to manage the patient. I'll get her started on ceftriaxone first. I'll just pick an arbitrary dose for now. So, yeah, so you can do a wide variety of clinical actions as you would in real life. You can even consult other specialties. You can talk to a nurse, even. So, the patient will keep reacting to things, and we've had biological modeling for everything. Like there's pharmacokinetic and pharmacodynamic modeling for the drugs that you give to the patient, and there's disease modeling on how the patient would basically deteriorate or improve. At the end, you can discharge the patient. You can even take a photo when you're using this on your phone, and you can take a photo of the prescription or discharge summary you've made, and we'll rate and review that prescription as well. And then I'll just quickly discharge this patient, and then we get a detailed feedback at the end on the things that we did right and what we did wrong, basically. So it will tell me that I shouldn't have discharged this patient, and yeah, it will take a bit of time. So it will also reference the latest guidelines to tell me the ideal clinical pathway, how I should have communicated with the patient, what actions I should have avoided, how I should have probably handled things better. And yeah, you can keep generating infinite cases. We have a curated case library as well. You can talk to the on-screen tutor for any help. It's a voice agent which can guide you really well, and you can even like chat to it, and it will reference
Hi,
related
I'm Mira.
articles to help you.
Want me to show you around, or should we work through what you're seeing right now?
No, thank you. So yeah, you can even choose the on-screen tutor, which is an AI agent, and it will help you solve the case on your screen. So you can see the clinical pathway, what you should have followed and what wasn't done on time. Yeah, it will basically give you detailed feedback, and it will reference the guidelines used as well. You can even visit the website. Okay, that's it. Thank you.